The aged care workforce will receive a pay rise, delivering justice and dignity to them and the elderly residents they devote themselves to. The increase will usher in a new era for the sector, which for the past decade was said to be held together by the goodwill and commitment of a severely underpaid and insecure employed workforce. Joining me live now to discuss this is Health Services Union Secretary Gerard Hayes. Gerard, thank you for joining us. The aged care workforce will receive this wage rise of between 7 and 28%. What's your response to these increases?
It's certainly long overdue, and it's a great outcome for the vast majority of workers in health who are women. I think it's really important that we note at the moment the average superannuation balance for women working in aged care is $18,000. So having a wage going for increase between 18 and 28% brings them into a competitive market with health facilities across the country.
Apart from impacting their superannuation, how will this increase assist aged care workers today?
So effectively, one figure is going from $21 an hour to $32.50 an hour. These workers then will be able to do one job, not work at 2 or 3 different facilities to make ends meet. People will be attracted to the aged care industry as opposed to leaving it. And so the support for the workers, the support for aged care recipients will be enhanced, and that will be a major step forward, particularly when we're looking at an ageing population and more pressure coming onto aged care.
This case was originally lodged by the Health Services Union in the Fair Work Commission in November of 2020, right in the middle of the COVID-19 pandemic, where no doubt the sector saw some of its darkest days. What are some of the challenges these workers face that the majority of us may not know about on a day-to-day basis?
Look, one of the most simple things that none of us, and I've had a long history as being a paramedic, that what happens with aged care workers is they look after our elderly. Our elderly in the later parts of their lives, so people pass away, they befriend them, become like family members, and they lose them. And this trauma happens to aged care workers every single day. There's no other area of health that I can think of that you continually get to know someone on a personal level and you lose them. And that's part of the giving that you have, and that's part of the emotional sort of drain that you're subject to. But these are the sort of people who turn up to aged care. So it's quite wonderful that they're being recognised for what they're worth.
So no doubt the response has been incredible from the workers and yourself moving forward. What other implements are you looking to make to better the sector?
So we want to still do more in terms of the support services, because we see that aged care is not just about 1 or 2 roles. It's a collaborative workforce. Most of the workers, irrespective of what you do in aged care, will interface with aged care residents. But we're very keen now to ensure that the resourcing, so there are enough workers to be able to support the growing demand, but also the qualifications, the training, the enhancement to enjoy the job and expand that enjoyment is going to be vitally important as we see more people coming into the sector.
Gerard Hayes, thank you for your time today.
Pleasure. Thanks very much.